want our patients, when they come to Broward Health North, to have a 5-star experience. That means that we want our patients to have outstanding customer service, excellent quality outcomes, and to cause no harm. Keeping our patients safe, that was one of the motivations for joining the Hospital Engagement Network, because we want to reduce our overall infection rates.
Any invasive device that's placed into a patient can increase their risk of infection, depending on the amount of time that they're put in and the care that takes place of that device. So central lines either need to be in appropriately or they need to be removed because the risk of infection just increases for all the time that they are in.
When I say chasing zero to my staff, what I mean is that we want to have a hospital, Broward Health North, where we have ultimately no acquired negative incidents for our patients, no infections, no falls. We want to keep our patients safe.
I think the top 3 things we've done to reduce CLABSI within our facility is, first of all, paying attention to what's going on with the rate. The next thing would be actually consistently implementing the initiatives, using the CLABSI prevention bundle, and then our dedication to having everything you need present and convenient to comply with the bundle. So you walk into our rooms and on the wall are alcohol swabs and alcohol caps for the IVs and reminders to clean your hands, and hand cleanser inside and outside of every room with reminders.
On a daily basis, nurses are assessing the central lines and they are discussing it with physicians. In a conversation about how much longer do you think that the line may be needed, the collaborative approach really benefits the goal of getting that line out as soon as possible.
I think that's a great plan for this patient.
Since we've been participating in the HEN, at the onset, we took our total number of CLABSIs and calculated our rate for 2011. And then we engaged in the prescribed initiatives and the recommended steps to reduce the rate. We set out our baseline, and then we calculated our target as a 40% reduction. The goal for the HEN being to get to there by the end of 2013. We achieved that goal 6 months ago.
That's remarkable.
For the whole hospital. In addition to that, we got our ICU CLABSI rate down to 0 for 7 continuous months now.
The HEN data is an easy report to read, and we're able to share that with the staff. And from there, we look at it together to see what else can we do to sustain our successes.
Good morning.
Good morning.
I am extremely hands-on because I feel that my job is to be out there talking to as many of the employees and the physicians as possible. How are you doing this morning?
I'm good. How are you?
And helping to clarify and to reinforce and to recognize and to acknowledge the outstanding job that you're doing at the bedside. Oh, you're replacing the flowers today.
We don't want to cause any harm and we don't want to cause any infections. And being part of the HEN gives us that network, the education, and the information to be a true zealot for zero.
Great job.
Thank
you so much.
you.
Since we've been participating in the HEN project, we have really had some outstanding results. For the past 7 months in the intensive care units, we have had 0 CLABSI infections, 0. That's what it's all about. That's what chasing the 0 is all about.
Thanks for tuning in to HRET Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.